The COVID-19 pandemic created one of the largest social and economic upheavals in recent history and impacted nearly every facet of daily life for most individuals. Vulnerable populations were disproportionately impacted, including children who experienced significantly less opportunity for social-emotional engagement, learning, and sensory processing, paired with the loss of a sense of safety, relationships, and routine. The reverberating impact, or echo, from the past 3 years requires us as providers to have a new lens, especially when working with young children and their caregivers. Parents, preschool staff, mental health professionals, and medical providers, many of you are raising concerns for our youngest generation of children. We all realize that many children did not receive medical care or socialization opportunities. The result is many children who have behavior or developmental lag that is challenging parents, preschools, childcare, and medical professionals to find the right interventions. Our community's resources for the young child were not enough before the pandemic, and now our system is even more stressed and less accessible to families across the Inland Empire. Thus, to best serve the children, we must keep in mind the impact of the pandemic echo on the young developing child and offer parents information and advocacy to attain the appropriate interventions. While well-meaning, referrals for treatment or intervention without adequate assessment can be very risky, especially in this post-pandemic time, and may result in less effective or even harming interventions. What also makes the situation so critical at this time is that the demand is high and the supply is low. Thus, treatment is hard to attain. The wait lists are long, and often the treatment that the child has been waiting for does not match their needs, either because of the lapse of time from referral to treatment or because this was not the right door for this child to begin with. As such, it is crucial that suitable assessment is completed and that children are sent to the appropriate door or doors for treatment. We hope this information will help you to better serve children with special needs in the Inland Empire. The following are some doors that are important for children 0 to 3 years of age living in the Inland Empire. Door number 1 is Inland Regional Center's Early Start Program. This is an early intervention program for infants and toddlers under 3 years of age who have a developmental delay, a disability, or an established risk. Inland Regional Center Early Start Program serves Riverside and San Bernardino counties and offers free services for eligible infants and toddlers. Another important doorway is the proper assessment. When a neurodevelopmental disorder is suspected, the family should be referred to their medical insurance company to request a diagnostic evaluation. When a behavioral or mental health disorder is suspected, the family should be referred to their insurance company or county mental behavioral health to request a mental health evaluation. The intervention and treatment service door is critical to ameliorate the child's trajectory. Infant and early childhood mental health services are important for infants and toddlers with difficulty with social or emotional concerns. They may have had regulation concerns, difficulty in relationships, and/or behavioral concerns. If the child has delays in language or is difficult to understand when speaking, they should be referred for a speech-language evaluation. If they have feeding difficulties, swallowing or coughing, choking during feeds, you should also refer them to speech-language for evaluation recommendations. For children who are delayed in their daily function or adaptive development or have fine motor concerns or sensory concerns, for example, they are sensitive to sounds or their engine runs fast, they should be referred for occupational therapy evaluation or treatment. If they have feeding difficulties that are oral motor concerns, refer them to OT for evaluation. For children who need a specific behavioral intervention, typically for children with ASD or other neurodevelopmental disorders, a referral for evaluation or appropriateness for applied behavioral analysis or ABA may be warranted. Also, it is important to indicate if the child has experienced trauma to request that the treatment providers offer trauma-informed care. Door number 4 is education. Local school districts provide help to children, particularly children with solely low-incidence disabilities, The deaf, blind, orthopedic impaired, visually impaired are often referred to schools for services. Additionally, after the age of 3, the school districts may provide special education or early intervention services free of charge to families. Early Head Start and Head Start are also educational programs that are free for families who have lower household incomes, receive public assistance, the child is in foster care, or are homeless regardless of income. These programs may offer center and home-based options. Our last door is often one very important to families. To assist them beyond your referral to accessing the services is local support agencies. Families are often overwhelmed at this part of their journey. It may be a new diagnosis for their child, and they are just learning what that means, what they need to help their child, and are trying to navigate many systems as well as dealing with the emotion of it, all while parenting. Families can find it helpful to talk with other parents who have experience with the emotion of it all and dealing with the different systems. There are many organizations throughout the Inland Empire targeting different disabilities, ages, and languages. For an extensive list, visit ieautism.org support groups. Also, for more information regarding pathways and referrals for all of these doors, please see the document linked below. Isaiah's experience is a good example of the importance or impact of the doors we refer families to. Isaiah is a 31-month-old African-American boy who lives in foster care and whose history is significant for maltreatment, neglect, and physical abuse. Prenatal drug exposure and premature birth. He has a resource parent that was overstretched by taking in Isaiah's other 3 siblings as well. In addition, due to the pandemic, Isaiah's delays and physical concerns were not identified and addressed. Considering his significant delays in behavioral concerns, his PCP referred him for ABA and gave an autism diagnosis. However, later, when Isaiah was provided a complex evaluation, it was determined that he had trauma symptoms, global development delay, and sensory issues, as well as vision concerns that accounted for his developmental and behavioral concerns. Importantly, his social engagement was Isaiah's strength. ASD was not the correct diagnosis, and applied behavioral analysis was not the correct treatment. Without the proper interventions, mental health treatment, occupational therapy, and speech-language therapy, Isaiah was not getting better, but in fact his development was lagging further. In addition, his vision issues were missed, and Isaiah's vision problems were playing a role in both his developmental lag and behavioral concerns. His wait time for entry into a preschool was also impacted by his diagnosis. These past few years may have been one of the most difficult times for the families we serve. Let's work together and advocate for the youngest members of our community, and remember to take into consideration the pandemic and other environmental impact as we help families navigate these doors. Also, let us remember that our post-pandemic life is uncharted territory, and we will need to give each other grace as we navigate it.